everyone. So I welcome you all to this FB Live by CBCC Cancer Center ILS Hospital Agartala. I hope all of you are safe and sound. So today, as we know, our topic of discussion is role of a healthy lifestyle in cancer prevention. And for that, we have an experienced and renowned doctor with us, Dr. LP Bhaskar Bhuvan. So Dr. LP Bhaskar Bhuvan is a consultant medical oncology, hemato-oncology, and stem cell transplant at CBCC Cancer Center Agartala, a center that provides 24 by 7 cancer care in the state of Tripura. Dr. Bhaskar's area of expertise are medical oncology, hematology and bone marrow transplant, and pediatric oncology. He is skilled in the management of adult solid tumors, pediatric solid tumors, and pediatric and GI cancers. Dr. Bhaskar also holds a special interest in preventive oncology. So I take the privilege to welcome Dr. LP Bhaskar. Welcome, Doctor.
Yeah, hi. Thank you for the.
So, Doctor, we are really glad and privileged to have you.
Yeah, thank you for your kind introduction. So yeah, so can we proceed with the topic?
Yep, Doctor. So, Doctor, my first question is, it's the umbrella question that what role does a healthy lifestyle play in cancer prevention?
Yeah. So let us discuss about the healthy lifestyle and its association with cancer. So I'll explain the topic in the first 20 minutes. You can have your questions in the chat box or in the end of the talk. Okay? So let us come to the topic. What is healthy lifestyle? Okay. So what is its association with cancer? So everyone will think that whether whatever the lifestyle they are having, really it creates a problem. I mean, whether it causes cancer in the future, because multiple patients or the common audience usually ask me, so whether doing this will cause cancer, doing going CT scan regularly causes cancer, like that. Multiple people eating something, or our grandparents, our parents always tell eat this, eat that, like that. Everybody has a lot of questions in their mind. What causes cancer? Which will help in preventing cancer? So, what modifications we have to do in our routine lifestyle so that in future we are get away from cancer? Okay. So, getting into the topic. So, what are the normal lifestyle usually a person has? Okay. So, right from the morning, once we wake up from the bed, so what we think about, in the routine lifestyle. One is the diet. What kind of diet is good for our health? So what kind of diet usually prevents from cancer, and what kind of diet usually causes cancer? So that is one thing. Second thing is addictions. Addictions is something we are dependent on, okay, which are really useful to the body, which only just causes harm to the body, like smoking. Okay. Alcohol. So what else really mentioned in the lifestyle changes? One is comorbidities. Comorbidities, other associated long-term illness. So next one is the comorbid illness. So like obesity, diabetes, cardiac disease, all these things. Okay. And what else really matters in our day-to-day life? One is the sexual behavior of a person. Okay. And work life, environmental factors like the kind of pollution, environmental pollution, how it affects the human being. So all these are the common factors which usually creates doubts in a person whether this causes cancer or not, like that. So these are the main 5 important factors. And sedentary life, that is another one more important thing. Sedentary life, that means most of the people are white collar professionals. So because of that reason, everybody will have a majority of the time sedentary life. So because of that, whether it really causes cancer or not, this is also a one important question people ask regularly. So in this, the first most common thing is the diet. So what exactly our Indian diet usually made up of? Not only Indian diet, any diet. Okay, what kind of diet usually made up of? Usually measured at the times. Usually we eat rice or wheat. Okay, so carbs, mainly carbohydrates. It will give. Second thing is the protein, and third one is vegetables. Okay, which gives fiber and some amount of protein, some amount of minerals, vitamins, all this stuff. And additionally, people also eat curd or fruits. So this is an average Indian diet includes. Okay. So also, so on an average, depending on the type of activity, because the kind of work a laborer does is different from a software employee. Okay. So on an average, it is mentioned that 2000 to 2400 kilocalories is the usual calorie requirement for a person per day. Okay. If you eat the same amount of calorie intake, required amount of calorie intake, then it is not a problem. But if someone eats beyond this limit, so it can cause obesity. Okay. Also, high calorie intake or high glucose intake directly will not cause any kind of cancer. But if it translates into diabetes, long-term diabetes, or if it turns into obesity, then it may become some kind of risk factor in the future development of the cancer. Second is the protein. So what kind of protein usually Indians take? Usually it is the dal. Second thing is the meat. So the plant-based legumes or plant-based pulses is usually healthy. It doesn't cause any side effect or any long-term relation with the cancer. But eating meat, particularly the red meat. So again, people think that what is red meat? Red meat is the usually the meat produced from the pork, beef, or goat. So the muscle meat, basically, which is in pinkish or reddish in color. So that meat has very strong correlation with the cancer, particularly colon cancer, that means large intestine cancer, and some amount of breast cancer. I mean, some amount of patients had liver cancer, and some also have relation with this red meat particularly. And another important thing is what kind of, I mean, what is the way they cook the food? Okay, like if someone cooks the food by boiling or this protein particularly, then it doesn't cause much problem. But if somebody cooks the meat by using smoking, like a smoked meat, people some part of Northeast India like barbecuing the meat, like chicken or mutton, anything. So they do the expose the meat to the high flames. Then again, it will create a toxins, some kind of toxins. Okay, so that toxin have again carcinogenic effect, cancer causing effect. Okay, so next comes to the vegetables. Usually, taking vegetables will give you the adequate amount of the fiber into your body, which is helpful to your body, which decreases the risk of cancer to your body. And in that particularly, colored containing vegetables like tomatoes, carrots, beetroots, where lot of amount of beta carotene and fiber is available through these elements will usually decrease your toxin content in your body. So particularly cruciferous vegetables like cabbage, cauliflower, radish, broccoli, these have that high nutritional value where you can have the less amount of toxicity or toxins in your body. Okay. Next comes to the curd. So curd and eggs usually contain rich amount of calcium. So usually taking calcium through diet is didn't show much effect on cancer risk. But if you take calcium supplements additionally through tablets, it has some protective effect against colorectal cancer. Next, finally, is the fruits, particularly patients who doesn't take fresh fruits or salads, who lacks that, I mean, whose diet lacks in vitamin C related fruits like citrus fruits, they have again high risk of getting colorectal cancer. So all this data, whatever I explained, is through multiple research studies explained all over the world in thousands of patients, lakhs of patients actually. Okay, so more or less the crux of the diet plan should be what are the required amount of calories you have to take. Like that you have to take, you should not take the refined foods like sweets or anything, okay, like maida kind of thing, where the lot of refined sugars will be present, and protein should not be smoked, and vegetables, good amount of colored vegetables you have to take, like tomatoes, all this stuff, and curd and fresh fruits is the usual thing. This is the usual diet plan you should have. So, and I'll tell you how much is the recommendation, what should you take. Second one is the, apart from that, second thing you think of the addictions. Okay, in that smoking. So smoking is one addiction. Everyone knows that it directly causes, or directly or indirectly causes cancer, different types of cancers, particularly oral cavity, throat, and the lung cancers. Apart from these cancers, can also cause pancreatic cancer and liver cancer also. So not only the person who smokes, the other person, like the wife of a person, smoker, otherwise the mother of a smoker, which is called second-hand smoke. These people are also at risk of developing lung cancer or throat cancer. And there is another concept called third-hand smoke. That means if the smoker, after smoking, goes away from the room, and the child will come and play in that room. The what are the smoked particles dusted around these carpets or curtains? These will again inhaled by the child, and which can cause again tobacco-related toxicity in the child. So it's called third-hand smoke. Even though the risk is not as similar to the smoker, but it has some risk. Okay, so all the studies show that very strong correlation between the smoking history in whatever the way, whether it is inhalational or just chewing or whatever the way, it has strong correlation with the different type of cancers. Okay. So next one is the alcohol. The US FDA already notified that alcohol is a carcinogen because it has a compound called acetaldehyde, so which is highly carcinogenic. So usually alcohol causes esophageal or food pipe cancer or stomach cancer, and almost the risk is almost 5 times than the general population. And liver cancer and pancreatic cancers can also come. Okay, so but it all depends on how much amount of alcohol they take. So people who take 40 grams of alcohol per day, okay, that means usually a normal beer will contain 14 grams of alcohol, or a small shot or single, I mean, a shot of whiskey contains also 14 grams of alcohol. So if the amount of intake per day is 40 grams, that means maybe 3 packs per day, like that. So it can increase the risk of developing cancer, particularly esophagus, stomach, and liver cancers in these patients. So apart from that, smoking with alcohol, so I also mentioned about the occupational pollution. Okay, so occupational pollution means, see, someone working in a chemical industry, dye industry, textile industry. So they are exposed to different kind of dyes and chemicals. These people will have risk of developing urinary bladder cancers. Someone is working in chimney industries or where the dusting everything they will do. The suit industry, we call suit industry. Okay, so those people are very much um, at risk to develop skin cancer. Okay, so depending on the type of profession, the chance of developing cancer also depends. Okay, someone works in coal mines, so they have the risk of developing lung cancer in other smoke-related cancers, particularly lung cancer and skin cancers. Okay. Apart from that, routine exposure to the sunlight, UV light. Okay. So because through sunlight also we receive some amount of radiation over the days and years. So always you have to protect your skin from the sunlight because to save from your body from the unnecessary radiation. Okay. So these people can have some kind of skin cancers like melanoma, where this is not very common in countries like India, but it is very common in countries like Australia and New Zealand, where the ozone layer was damaged, where the exposure to the sunlight and UV rays is very high in such areas. Okay, so this all depends on what kind of occupation they are and what kind of cancer causing agent they are exposed to. Okay, next is the comorbids. Comorbids, one thing is diabetes, second thing is obesity. Okay, so diabetes, we know that usually uncontrolled diabetes usually can cause long-term side effects like cardiac disease, kidney failure, eye issues, all this stuff, and strokes. But apart from that, cancer is also very highly notified consequences of uncontrolled diabetes, particularly endometrial cancer, that means uterine cancer. Is almost 7 times high in patients who had diabetes, uncontrolled diabetes. Apart from that, liver cancer is also common with the diabetic patients. Okay, and pancreatic cancer also seen, but most commonly we can say uterine cancer and the food pipe cancer, liver cancer. These are strongly associated with uncontrolled diabetes. And next is the obesity. So obesity usually depending on someone's height and weight, we divide whether they are obese or not. So we take a calculation of body mass index. So usually most of the people's body mass index will be between 25 to 30. But people who have more than 30 or more than 40, we call somebody having body mass index of more than 40, we call severe obese patients. These severe obese patients have almost 7 times high risk of developing colorectal cancer, endometrial uterine cancer, breast cancer, and prostate cancer, food pipe cancer, stomach cancers. These are very high risk in these patients. How obesity will cause these cancers means usually obesity will increase the fat deposition in the body. Fat deposition in the body. So these fats will create some kind of toxins, will release some toxins which will damage the cell DNA in a human being. Okay, and also this excess fat will increase the estrogen hormone in a post-menopausal woman, so which causes breast cancer, ovarian cancer, endometrial cancers. Okay, and it also releases some kind of cancer-causing factors like insulin growth factors, leptin, these kind of different cancer-causing hormones. They release the excess fats, and which causes finally to prostate cancer, colorectal cancer, and this stuff. Okay. So whatever the excess calorie intake patients, normal people take will create obesity, and this obesity and diabetes, usually these will finally lead to this whatever I said, colorectal cancer, uterine cancer, all this stuff. Okay. Next is apart from comorbids, somebody's sexual behavior. Okay, so always you have to go with the safe sex. Okay, you have to be with the monogamous with a single partner. This is the usual recommendations because the sexually transmitted disease incidence is very high, particularly people who have relation with multiple partners are polygamous in nature. So, for example, if I take in US, almost 4.5 crore population were already infected with the human papillomavirus like things, by infections. Why I'm insisting this? This also has relation with association with cancer is particularly sexually transmitted infections like HIV, HBsAg, HCV, and human papillomavirus. HIV, human immunodeficiency virus, which is also called AIDS once they manifest the disease, hepatitis B, hepatitis C, and human papillomavirus. These are the viral infections which are usually transmitted either through blood or through sexual transmission. So HIV causes different kind of lymphomas in humans, and hepatitis B and hepatitis C has high incidence of developing liver cancer. And human papillomavirus, which is one of the notorious viral infection, which is not detected commonly, but it has very high chance of developing cervical cancer. It is the most common cause for development of cervical cancer in the entire world. Almost the correlation is 95%. Next is sedentary life. So if you ask me, the sedentary life, whether really causes cancer, means that uh, association is not that much strong. Okay, so people studied a lot in thousands of patients, but it's very mild risk sedentary life. Also, sedentary life is not causing any kind of cancer. But some reports are there, it can have association with colorectal cancer. But sedentary life can cause obesity, diabetes, then it can lead to the other type of cancers, whatever I explained for the obesity and diabetes. So these are the usual factors in our lifestyle which can manifest or associate with cancers. So what should we do to avoid such kind of consequences? Okay, so first, so whatever the risk factors or causative agents I explained, you have to reverse them. Okay, first one is the diet. Okay, so always take the required amount of diet. Okay, only the required amount of standard diet at same time regular. Punctuality should be there while having your diet. Okay, so you should not skip your meals. You should take it a proper timing. Okay, and your diet should have the required amount of calories, not excess calories or low calories. Really required, like 2000 to 2400 kilocalories only. You have to plan. Okay, always avoid smoked food. Okay, and salted pickles, stored foods, salted fish. These kind of foods, please avoid. Always prefer to go with a plant-based protein rather than animal-based protein. Okay, and usually include in your diet with two to three cups of fruits every day, particularly citrus fruits. Okay, and apart from that, you can have this curd or yogurt every day, where the probiotic or the lactobacillus in that will help in improving your gut motility and will decrease the cancer risk also to some extent. Okay. And some people will ask me, yeah, and one more thing is colored vegetables like carrots, beetroot, tomatoes, these kind of vegetables, please encourage your family to take. And okay, and also include millets in your diet. Okay, these will definitely decrease your risk directly or indirectly, because this whatever the changes we I explained usually decrease the obesity risk, diabetes risk also, which finally also decrease the risk of overall cancer risk. Okay. So second one is the people will ask me, so whether taking this antioxidant tablets like some multivitamins, all this stuff, really it will benefit. Yes. Actually, in animal studies, all these multivitamins or iron or whatever the elements normally people consume through tablet supplements, so they had some kind of benefit in the animal studies definitely, but in the humans, they studied for almost 12 years. Okay, every day by giving these elements for over 12 years, but they couldn't prove that there is decreased risk in these patients. All over the world, almost more than 2 lakh patients were screened with this kind of multivitamins and everything. Okay, second one is the addictions. So best is always with smoking, because if you stop smoking, usually the changes will slowly turn up, and after, but it will not come down immediately. Always please remember, whether alcohol or smoking, once you skip the both the addictions, usually it will not come back immediately. It will take time. So the studies say that is after living for almost 50 to 60 years also, still the effect is there. Like if the risk is at 7 to 9 times when someone is smoking, the risk decreases to 2 to 3 times after 15 years. So it will decrease definitely, but it will not normalize. For to get normalized, it will take almost 15 to 20 years. Okay, so if someone smokes for almost 30 years, that is up to 55 years, if they smoke, then usually it is recommended to have a low dose CT. If he is a heavy smoker, that means they are doing every day some 10 to 20 cigarettes per day. Okay. So for the same thing, alcohol also, the esophageal cancer and pancreatic cancer and throat cancer, the risk has decreased definitely, but it was not normalized after 15 to 16 years. So it's better to uh, get just to get out of these addictions. Yeah, one more thing people will ask me, uh, taking tea or coffee, is it good or bad? Yeah, if you ask me, uh, compared to coffee, tea is more beneficial because tea has usually polyphenols. Okay, these are actually antioxidants, which will it's like a multivitamins kind of thing. So this is polyphenols is in green tea, and theoflavins is in black tea. Okay, both of these will decrease the toxins in your body. It was already proved in a lot of studies, and it will also help you protect your skin from UV rays, and it will also improve your immunity. But researchers couldn't prove that these will definitely decrease the cancer, but the toxins in the body will definitely decrease. That was already proven. But usually, coffee has not that much as benefit as tea. Okay, so next is the uh, diabetes and obesity. So in this also, patients who studied rigorously almost for 12 to 15 years, patients who lost weight over a period of 3 to 5 years, those patients had almost 40% decrease in their cancer risk over a period of 12 to 15 years. It was also proved in the studies, in almost hundreds of studies, it was proved actually, the same values actually. So definitely decreasing the obesity definitely helped the patients to decrease their cancer risk. Okay. Next is the exercise. Sedentary life and exercise. Always be active, do exercise. So do really exercise decreases the risk? Yes, it was proved in various kind of studies, multiple studies for lakhs of patients, where almost 15 to 20% decrease in the risk of stomach cancer, esophageal cancer, prostate cancer, breast cancer by doing exercise. So, okay, then people ask me how much exercise I have to do. Usually, what kind of exercise you are doing, it depends. Like
I guess there's some technical problem. Doctor will join us in some time. Hello, doctor. Doctor, is there any network issue? Viewers, please be with us. Doctor is joining us back in seconds. So today we were talking about the role of a healthy lifestyle in cancer prevention, and Dr. Bhaskar was explaining us the same thing, that what can be the modifications that we can make in our lifestyles to prevent the risk of cancer. Please be with us. Dr. Bhaskar, viewers, I guess there's a technical glitch. So I'm so sorry for the inconvenience. Dr. Bhaskar is joining us again in minutes. So please be with us. I'm so sorry. So Dr. Bhaskar has joined us again.
am I audible?
Welcome back, Dr. Bhaskar.
sorry for
Yep,
that.
yep, yep. It's okay, it's okay, it's okay.
Yeah, I'm explaining about the exercise. How much do people? Hello.
Dr. Bhaskar, we can continue. Yeah.
Yeah, yeah. So I'm explaining about how much exercise a person has to do routinely to decrease their cancer risk. Okay. So usually it is recommended to do 150 to 300 minutes of moderate exercise per week. That means overall 45 minutes to 1 hour of moderate exercise like doing shuttle, playing shuttle or tennis or some brisk walking, that kind of exercise. Okay. And if someone willing to go with a vigorous exercise like running, football or basketball, okay, swimming, such kind of vigorous activities, at least 75 to 100 minutes per week they have to do. Okay, and apart from that, it is also recommended from the research that at least weekly twice muscle strengthening exercise we have to do. Okay,
Viewers, I guess there's a technical glitch, but please be with us. Dr. Bhaskar is joining us again. Please be with us. I'm so sorry. Our team is looking into it.
am I visible?
Yes, yes, yes. Yes, Dr. Bhaskar.
So, apart from that exercise explained, I hope the exercise part was missed a little bit. Okay, just um, it is recommended to take vigorous exercise 75 to 100 minutes per week and moderate exercise 150 to 300 minutes per week, along with 2 days muscle strengthening exercises. Okay, so has shown definitely benefit of around decreasing the cancer risk up to 15 to 20% in the overall population. Okay, apart from that, um, sexual behavior, the vaccinations are available, particularly for hepatitis B and hepatitis B has vaccination. Now it included in the universal immunization program after a birth of a child. Usually at birth itself they are giving. And hepatitis C and HIV there is no vaccination, so it usually go for the safe sex. And apart from the human papilloma virus, which is a cervical cancer causing agent, so this infection can be prevented by using HPV vaccination. It is given 11 to 14 years of age, usually up to 17 years also you can go for this vaccination. So this is also as a pilot project started in India last month only. In some states like Maharashtra, Tamil Nadu, Karnataka, they started. So for all the school children before 14 years of age. Okay, so probably within the next few years it will be completely generalized to all the universal program immunization program in India. So, so I think we covered stress. Someone asked me about the stress. Yes, stress can also include the cancer risk actually, particularly prostate cancer. It was also showed in studies somebody having chronic stress, not for acute stress, only for chronic stress, because it has a lot of relation directly and indirectly, because it can also increase the diabetes or obesity related factors also it will increase actually. So, but chronic stress has relation with increase in cancer risk. So I think I covered most of the topics related to the healthy lifestyle and how to prevent these risk factors, control the risk factors in my talk. So I think I'll be happy if you ask me some questions actually.
Yes, sure, Doctor. We have certain questions from the viewers, so we will take them up. Can we?
Yeah.
Yeah. So first question is from Shimona H, and she's asking about the stress, which we have recently talked that can stress reducing activities help to reduce the risk of cancer?
Yes. See, as I mentioned, particularly in men, stress cause chronic stress has almost in some 70,000 patients it was studied. Patients with a different questionnaire, depending on the level of stress, it was studied for over 10 to 12 years. It showed that in women, the risk of breast cancer and colorectal cancer has increased in these patients who had chronic stress. In men, prostate cancer risk has increased over the period of time, actually.
Okay,
So
Doctor.
it's quite stress. go for a healthy lifestyle.
Yes, sure, doctor. So next we have is from Pragya Khanna. She is asking that her work requires long sitting hours, which leads to a lot of health issues. So does this also increases her chances of developing cancer in the future?
Yes, so I mentioned in my talk that sedentary lifestyle has, I mean, it is not consistent in the studies. Actually, they studied in different kind of population, both in Asian population and European population. But the risk they are able to achieve is very minimal when compared to the
Mhm.
like smoking or alcohol, which causes very strong correlation with cancers, or obesity or diabetes can have very strong relation. But that much strength is not seen with the association between the sedentary life. But sedentary life will cause other kind of problems like cardiac diseases, obesity, diabetes, all this stuff. Maybe after once achieves that kind of comorbidities or achieves that kind of topics, maybe they.
Uh, Dr. Bhaskar, are you there? So, viewers, please be with us. Dr. Bhaskar is joining us again. I think there are some technical issue on his end, but please
Yeah,
be with us.
yeah. Hello.
Yes, yes, Dr. Bhaskar. Go ahead.
Yeah. So regarding student life, already I explained. So basically, it will increases the stress hormones directly or indirectly will increase their diabetic potential. Okay, they are very much prone to develop diabetes and also
Oh,
obesity. These develop comorbid illness, which are again a risk factors to develop some kind of uterine cancers or this kind. But if you ask me the direct relation, that is without developing obesity or diabetes, only just sedentary life relation is very minimal with cancer risk. Okay.
okay. So, next we have is from Dr. Sagar Das. He is asking, are there any chances of getting a cancer from food that we carry from or that we store in plastic containers?
Yeah, so basically plastic related these things. So maybe it can cause, but we are not able to proceed everything. Whatever we speak, it should be understand through studies, research. Okay. So for like whatever I explained, like salted fish or pickled fish or stored food, these things have already proven relation with cancer, stomach cancer and esophageal cancer. With the plastic, still there is no proper evidence to say that yes, strongly plastic stored food has some relation with cancer or not. But we have to prove it. But also, at this point of time, there is no standard guidelines related to the plastic thing. But something which is stored, long-term stored or pickled or salted food has relation with the stomach cancer and esophageal cancer.
Oh, okay, okay, doctor. Thank you. So, next question is from Tanmay, Tanmay Shaha Bhaumik. Uh, he's saying that please suggest prevention tips in HN cancer, head and neck cancer recurrence.
So basically, in head and neck cancer, the how to prevent the recurrence. That's what I'm asking, or just to
Yes, yes.
prevent the head. Which one? I mean, how to prevent recurrence or how to prevent head
So,
and neck
I
cancer?
think he is asking how to prevent the recurrence.
See, first thing is stop smoking. That is the first important thing. Okay, this is which is expectation from a doctor to a patient, because most of the times patients won't smoke again after having this oral cavity and head and neck cancers. That is true. And also the alcohol consumption also should be stopped. Okay, and apart from that, it will be again it's not related to the lifestyle measures. It will depend on the treatment modalities. The recurrence depends more on the what kind of therapy he took and what kind of chemotherapy he received. Okay, what kind of surgery he had undergone. All these factors will decide his recurrence actually more than his this lifestyle or healthy habits. Okay, but the first to prevent head and neck cancer completely means see in my experience most of the oral cavity, throat cavity, I mean throat cancers has strong correlation with the tobacco chewing or smoking. Okay, I've seen many people had almost 90% of the patients had this history, or patients also do the reverse smoking, that means the burnt end of the tobacco. Okay, so they keep in the under the mouth, okay, under the tongue. So that is one thing usually in some parts of India they do. Okay, they have also mainly palatal or gingival cancers is a one possibility, and decrease the alcohol consumption. That is one thing we can suggest. Okay, because most of the tobacco and alcohol related cancers are oral cavity head and neck cancers.
Okay, doctor. So I think, doctor, we are done with the viewers' questions too. So thank you so much. You have explained things really well. So thank you so much. Thank you so much, doctor.
Thank you.
So, doctor, any concluding remarks for our viewers?
Yeah. So see, from my side, see, always stay healthy. See, always good habits will lead to good health, and which finally leads to good life. Okay, so always keep your routine fit and standard. You can do the exercise, right amount of right amount of diet you take, and and you just get away from the occupational hazards and get the annual screening, all this stuff, whatever I explained. So if all these things, I think definitely the chance of cancer risk is very minimal. But it's very difficult to follow this. But if it is followed, definitely it will benefit. Okay. Thank you.
Sure, sure, doctor. Thank you so much. So, viewers, I hope you have enjoyed the session and gained really interesting insights. So, if you or someone you know ever need a cancer consultation, you can definitely visit Dr. LP Bhaskar Bhuvan at CBCC Cancer Center, ILS Hospital, Sagartala. So, thank you, doctor. Thank you, viewers. Thank you for
Thank
joining
you.
us. Thank you.